Good afternoon, everyone. Good afternoon. Welcome to the Kidney Disease and Mental Health webinar. We're so excited that you're joining us this afternoon and just look forward to sharing so many wonderful things about kidney disease and mental health. And I know I'm saying wonderful, but just the fact that we can come together and have information in this area, something that we don't talk about often, is a good thing to have. And so, thank you for showing up for yourselves today to get information. Also, we'll be going through the webinar and giving details about how you can participate. But again, welcome, welcome, welcome. We're going to go ahead and get started. It's not too late for you to share the link to sign up with your loved ones or family members. We want as many people as possible to be a part of this conversation today. So, welcome again. My name is Sharon Rouse. I'm the founder and executive director of Kindness for Kidneys, and I will be your moderator today. We're grateful that you've taken the time to join this webinar. This is our first webinar, if you can believe it, for Kindness for Kidneys. And so we're just so excited that this is going to be the first of many to come. And I'm excited for the panel that we have here for our inaugural webinar. And so I'm going to tell you a little bit about Kindness for Kidneys before we jump in and before we hear from our wonderful panelists. And then we'll go from there. This is us. This is Kindness for Kidneys. We're a nonprofit organization who is going global. We're going international, and we're dedicated to raising awareness and public health information of kidney disease. That is our big goal, to raise awareness and also to educate, encourage, and empower kidney warriors and their families. And so we're on a mission. We've been in this space for, it'll be 8 years. Actually 7 years in December. December 2nd, we celebrated 7 years. And so we're looking forward to continuing to change the narrative and to raise awareness in our communities. We're not talking about kidney health and kidney disease enough. And so our goal is to collaborate with other nonprofit organizations and businesses to continue to raise kidney health and kidney disease awareness. Here are our objectives for our webinar today. So we're going to explain the vital connection between kidney disease and mental health challenges. We'll identify psychosocial factors that impact the quality of life for kidney warriors and their care partners. We're going to encourage open dialogue to reduce the stigma associated with seeking mental health support in the kidney community and provide actionable strategies and resources for coping with the emotional burdens of the disease. Here are our webinar norms. And so you can use the Q&A feature. You should see it, depending on your device, of course, at the bottom of your screen. Use the Q&A feature for questions. Be respectful, of course. We're all here with various backgrounds and experiences and stories. And so we want to ensure that we're respectful of all perspectives and all questions. And then just a reminder that any information that's shared during the webinar, it should not replace the medical or psychological advice from your own healthcare provider. These are just some statistics. And so we never want to take for granted that everyone that shows up to our webinars or our support group meetings or anything is familiar with kidney disease and its prevalence here in the United States and around the world. But kidney disease is the ninth leading cause of death here in the United States. Approximately 36 million Americans are living with kidney disease. Over 800,000 Americans have kidney failure, and more than 550,000 are on dialysis. Diabetes and high blood pressure remain the most common causes of kidney failure, even though we're starting to see some genetic components and things like that we hope to have future webinars about. And then approximately 40% of dialysis warriors face depression and or anxiety. And I would venture to say that this also could apply to also other kidney warriors that may be transplanted or pre-dialysis and so forth. So it gives me great pleasure to introduce our first guest speaker, Tifiro Cook. Tifiro is a two-time kidney transplant survivor who thrived on dialysis for over a decade. While on dialysis, he owned a fitness studio where he personally trained and operated the business. Tifiro started exercise programs in the dialysis unit to help patients stay healthy while waiting for a life saving organ. Tafaro is now the founder of Kidney Care Coaches, where he coaches people with stages 3 to 5 kidney disease. Tafaro is married and a father of two. He enjoys exercising, traveling, reading, and building classic cars. So we welcome you, Tafaro. Thank you so much.
Thank you for having me today. I appreciate it. And thank you, everybody out there listening in this world. Again, my name is Tifiro Cook. I'm a two-time kidney transplant recipient. And let me tell you a little bit about my background and how I found out about me having kidney disease. I was playing college football my freshman year and right there on the field, started getting sick. Doctors took me in. First thing they did was saw that my blood pressure was like 215 over 130. Still trying to play football. It was kind of crazy. So first thing the doctor asks me, he goes, "Have you ever had a kidney problem?" And I'm looking at him like, I don't even know anything about kidneys. I'm 18 years old. I'm here to play college football. I don't know anything about that. So they did a biopsy on me and came out and found out that I had glomerulonephritis. And glomerulonephritis is it's kind of common now. We're starting to see it more, but back then when it first happened, we didn't see it too much. But now we're starting to see it more, and it's inflammation of the nephrons in the kidneys, and that's what happens. So my second year at college, I came home, and my sister came from her college, and she donated my first kidney transplant to me. That lasted for 6 years, and then after that, I did close to 12 years on dialysis. During that time on dialysis, I was always exercising. I was always trying to stay healthy, and wanted to bridge the gap between the two worlds. You know, I was going to dialysis, seeing people that were sick and everything, and I was, feeling that way also. But also, working with people who were just normal, people in college athletes, high school, just mom and pops and stuff. So I seen that exercise and nutrition was helping me, so why not help these people too? So what I started doing was started bringing small dumbbells and workout bands to the dialysis center. I didn't ask anybody. I just started doing it in the lobby. And what we started finding out was the patients started, being a little bit healthier. Their blood pressure started going down, phosphorus started going down, these things like that. And so after that, they asked me what I was doing, and I told them I'm just having them exercise. So, and another thing it did, since we're talking about mental health, it brought up the morale in the dialysis center. Because if you ever went to a dialysis center, it's almost like a morgue, And I'm telling you that for me, because I'm on dialysis again right now as we speak, and it's like a morgue. And you see people in there depressed and all these things like that. So just those exercises help people and things like that. So I got my second transplant at Johns Hopkins. It lasted for 15 years. And right now, since December 22, like I said, I'm back on dialysis, but I feel real good. I feel great. But going back to the mental health, when I first learned that I had to go back on dialysis, I was depressed. It hit me hard. It was mental. It was psychological. It was all those things. And what I mean by that was I'm on my way to the gym to go work out. And my doctor calls me. He says, "You got to come here real quick." So I went there. He told me that my creatinine was elevated and everything. And I had to go straight to the hospital after that. So just think about that here. We're talking about somebody about to go to the gym and work out and everything. Then all of a sudden, you have to go right to the hospital. It was a whack, And I sat in the hospital that night. My wife was she was with me and she went home and she was about to go on. She's a nurse practitioner. She was about to go on a to do a out of town work for her business and her what she does. And I sat in that hospital and I got depressed. I got emotionally upset and all these things because I thought I was doing everything right. And we as patients feel the stress of every time the doctor calls, every time you got to go get your labs, every time you have this anxiety because you're sitting on pins and needles because you want everything to go right. But sometimes these things don't go right, and you get a you're like, whew, when you see these labs and all the labs look good, you know. So just thinking about that, and then all of a sudden, you know, you're in a situation like I am right now, where I'm doing dialysis, and you know, you're in that position where you're trying to do everything you can to get on the kidney transplant list and stay. And in that time, you know, you got things going on. You got to worry about your insurances. You got to worry about what this lab is saying, you know, going to treatment, trying to live a regular life, and trying to keep yourself motivated. So when I talk to my clients now who are going through kidney disease, whatever situation it may be, they may be on dialysis, waiting for a kidney transplant, they might be in stage three. I always leave them, you know, when we talking, I always at the end of our time talking, I always ask them to tell me how they feel, and I just be quiet and I just listen to them because they go through their, you know, their challenges of what they're going through. You know, man, I'm trying to keep my job. I'm trying to keep, you know, strong with the family, but I got this disease hanging over my head, and it is very, very challenging, especially when, you know, it's kidney disease, because it's not like a lot of other diseases where you see people looking really bad. Kidney disease is kind of, you see somebody that they look normal. They look normal, but they're going through this thing. They're living off a machine. They're taking all types of medications, and all these things are happening. And people say to them all the time, "Well, you look fine." But just because you look fine doesn't mean you are fine. And that's the challenge. And you know, I wrote down a couple, you know, symptoms that you'll see. And sometimes when you know somebody who has kidney disease, talk to them, see what's going on, ask them if they're depressed, ask them if they're, you know, what they're going through, and let them just talk, because that's what I find. When they talk, they feel a little bit better, they get it off their chest, and they feel a little bit of relief. So, you know, again, so let me tell you about some of these things. Like, they put up the stats, but 1 out of 4 people are experiencing depression with kidney disease. You know, 1 out of 3 are on dialysis experiencing anxiety. And we're talking about, you know, when you see those statistics, 550,000 people, 1 out of 3, man, that's a lot of people. That's a lot of things, you know. Some of the other symptoms that you'll see in depression and anxiety are, you know, you have the fear, you have the worry, you have the panic attacks, all these things combined with you being sick, and you're trying to keep yourself, you know, physically and emotionally strong as possible. And these things are a big challenge, man. So, some of the other things are sleep troubles, you know, getting up in the middle of the night trying to get your sleep, but you can't sleep. Sometimes people sleep too much because they might be on dialysis and they don't have the energy to do anything, you know. And like I said, these things are a real challenge, but you can overcome them, you know, especially when you talk to somebody, especially when you talk to your providers and all these things, because they can definitely help you with these things. Okay, let me talk some more. Okay. Some of the
Thank
other
you
things,
so much, Tifiro. My apologies. I
no,
wasn't sure if you still had some more to share there. So thank you so much for sharing.
you're welcome.
I'm just, you know, just hearing you share just reminds me so much of how it impacts care partners, and how it impacts caregivers and families, and it's not just the person going through it, but it impacts the entire village in most cases. And so thank you, and thank you.
You're welcome. Thank you.
So it gives me great honor to introduce our next guest speaker. Our next guest speaker is Madeline Maldonado. She's a kidney transplant warrior. Maldonado is a proud Brooklyn native from Williamsburg whose life is marked by resilience and gratitude. Diagnosed at the age of 15 with ASC kidney disease and severe hypertension, she underwent a nephrectomy at 16 and continued to face health challenges into adulthood. After the birth of her son, her kidney function declined, and she was told she needed a transplant. Her son's father was tested, matched, and became her donor. On July 24th, 2012, Madeline received her life-saving kidney transplant. Now, more than 13 years post transplant, Madeline is thriving and deeply thankful. Her journey has shaped her into a strong advocate for wellness, community support, and especially mental health. Recognizing the emotional well being is essential not only during illness, but long after transplant recovery. She is committed to using her experience to uplift and empower others by navigating complex medical emotional challenges. Welcome, Madeline. Thank you so much.
Thank you. Thank you so much. Hello, everyone, and thank you so much for having me and for joining today's session. My name is Madeline Maldonado, and I'm honored to share my story with this incredible community. I am a Brooklyn native, born and raised in Williamsburg, and my kidney journey began when I was 15 years old. An annual wellness routine to the doctor showed I had high blood pressure. I was quickly admitted to the hospital and was diagnosed with Ask-Upmark kidney disease and severe hypertension, which caused reflux. At 16, I had a nephrectomy to remove my right kidney and scarring on my left. I grew up navigating doctor's visits, medication, and uncertainty that comes with living with a chronic illness. Years later, after giving birth to my son, my remaining kidney began to decline. My nephrologist told me it was time to prepare for a transplant. My son's father was tested, and so I was surprised he was a perfect match. On July 24, 2012, I received my transplant, a date I celebrate as my second chance at life. Thank you, Isno, for the selfless love and for giving me the chance to continue building memories with our son. And now, 13 and a half years later, I am grateful, healthy, and here with all of you. Today, I will share my lived experience on how I manage anxiety and what works for me. Living with kidney disease is more than a medical journey. It is emotional, psychological, and spiritual. Your identity shifts, your daily life shifts, your future plans shift. There were moments when I felt unstoppable and moments when everything felt overwhelming. The fear, the hope, the exhaustion, it's all real. And yet somehow you keep moving forward. One of the hardest parts wasn't just the physical symptoms. It was the emotional pressure of trying to be strong for everyone around me. Kidney disease shapes your identity as a daughter, a niece, a parent, a partner, a friend, an employee, and simply as a person trying to exist in the world. You carry the weight long before transplant and long after. The emotional toll on patients. For patients, the emotional toll is layered and constant. You're always waiting for labs, for results, for answers. You live with the uncertainty and fear of the unknown, the pressure of staying positive, trying to give to others while fighting for your own health. And even after transplant, the fear doesn't disappear. You're deeply grateful, but also afraid of rejection, complications, or setbacks. Sometimes the emotional challenges are harder than the physical ones. The emotional toll on caregivers. I want to take a moment to honor caregivers. They carry their own emotional weight. Watching us struggle, trying to be strong, and managing their own fears silently. My father's son, who became my kidney donor, carried emotional responsibility that I couldn't even see at the time. His act of love saved my life, but it also came with its own anxieties, worries, and sacrifices, all while caring for our 2.5-year-old. And also while both of us are going through physical healing after surgery. Caregivers deserve support, compassion, and a space to breathe too. Why mental health matters in the transplant journey. One of the most important lessons I've learned is this: Mental health is not optional in the transplant journey. It is essential, but I want to be honest about something. Throughout my entire journey, no one ever told me that therapy or mental health support was necessary. Not during the early stages of kidney disease, not while I was preparing for transplant, not after surgery. It wasn't until years after my transplant when I got a new primary care physician, shout out to Dr. Bobrum, told me, Madeline, you have medical anxiety. You should have been in therapy before and after transplant. Hearing that was validating. It allowed me to understand what I've been carrying silently for so long. Navigating mental health as a transplant warrior, when I finally allowed myself to explore my emotional health, things changed. Therapy, cognitive behavioral therapy, helps me understand my anxiety and separate facts from fear. I'm still a work in progress. Therapy isn't just talking, it's learning tools, building emotional resilience, and giving yourself space to breathe. Healing takes time and patience. Movement and exercise. Movement is medicine for my mind and body. Pilates has helped me reconnect my body after years of medical trauma. Strength training builds confidence and grounds me physically and mentally, making me feel powerful again. Exercise gives me control, energy, and clarity, things chronic illness tries to take away. Traveling with my son. Traveling with my 16-year-old son brings me joy, brings me peace and freedom. It reminds me that life after transplant is meant to be lived. Exploring new places together quiets the anxiety, and it reminds me that transplant is not just about surviving, it's about living fully. My circle of support. I am truly blessed with best friends and cousins who know my triggers and show up with love and no judgment. And for my mother's daily prayers. One of my best friends, Ayana, even reads my labs when I am too anxious to look at them myself. Their support keeps me grounded. Having people who understand your emotional triggers is a gift. No one should navigate transplant or any chronic illness alone. Breathing and grounding techniques. Deep breathing, grounding, and centering myself, especially before lab days, day of results, or major appointments, help me interrupt my body's panic response and return to the present moment. Naming my anxiety, one of my favorite tools. I give my anxiety a name. When it shows up, I tell it, I hear you, but I refuse to live in fear. It sounds simple, but it shifts the power dynamic. Anxiety becomes something I continue to manage, not something that defines me. Building a support system, community, finding people who get it, other transplant recipients, dialysis patients, support groups, and online spaces like Kindness for Kidneys allows me to feel seen, heard, and understood. Managing anxiety, I recently started journaling. I slowed down. I live in New York City, a high, fast-paced city where everything is on the go. There's times I had to learn how to slow down. I spend time with loved ones. I've learned grounding techniques. I celebrate small milestones and wins like stable labs or a good week of energy. Most importantly, I learned to give myself permission to be human. Some days I'm strong, some days I'm scared, and both are valid. As I close, I want to leave you with this. Kidney disease does not take away your strength, it reveals it. Your emotional healing is just as important as your physical healing. You are allowed to ask for help. You are allowed to prioritize your mental health. You are allowed to feel every single emotion that comes with this journey. Whether you're a caregiver waiting for a transplant, or living many years post-transplant like I am, you are not alone. Your story matters, your feelings matter, and there is so much life, purpose, and joy ahead of you. Thank you for allowing me to share my story. I hope it brings comfort, connection, and a reminder that true healing happens not only in the body, but in the mind and in the heart as well. Wishing all of you a beautiful holiday season and a prosperous new year. Thank you so much for having me.
Thank you so, so much, Madeline. Wow, what a powerful story. And again, common themes that I'm seeing here is that there is some vulnerability that's needed among us as kidney warriors to be able to allow people to support us. And it sounds like you have a complete village there, along with things that you're doing to strengthen your mental health. Wow. If for our participants, if you have any questions, feel free to put your questions in the Q&A chat. It should be at the bottom of your screen, depending on your device. But there is the opportunity for questions throughout, and we're also going to have our panel available at the end of the presentation for more questions. Thank you so much, Madeline. So now we're going to welcome Dr. Alice Way. Dr. Alice Way is a board certified nephrologist, a kidney doctor, who began her career in Harlem as a chief of the kidney division, at North General Hospital and medical director of a community dialysis center. For more than 15 years, she ran a private practice there, caring for everyone from community leaders and artists to people living with substance use disorders and those who were incarcerated. She now serves as Chief Medical Information Officer at Mitocon Advisors and Associate Chief Medical Officer at Nephrolitics, and recently joined Absolute Care, a value-based care company for patients with complex needs. Across all of these roles, Dr. Way is dedicated to the whole person care and to honoring the strong connection between kidney health and mental health. Welcome, Dr. Way. We're so honored to have you. Thank you so much for joining us today.
Thanks so much, Sharon, and thank you all for being here. I will just start off with a statistic. 1 in 5 American adults suffer from some form of mental illness today. Depression, anxiety, PTSD, schizophrenia, anorexia, etc. And only half get treatment. And I'm talking about just regular American adults, 1 in 5. Mental illness is even more common in chronic diseases like kidney disease. And we can probably have another entire webinar devoted just for caregivers, right? But do understand that it is very common. And whether you are a kidney warrior or a caregiver or an ally of the community, you're here and that's a win. I want you to remember 3 things from this webinar. 1, if you are having symptoms of mental illnesses, you are not imagining it. Kidney disease and mental health are biologically linked. Don't ignore mental health symptoms. Don't let it become a vicious downward spiral. The second thing is that you are not alone. You've already heard from the statistics and you've heard from the other presenters at this webinar here. There are many people with or without kidney disease who also struggle with mental health issues too. Mental illnesses are very common. The third thing to remember is that help works. Some good news. Addressing your mood, addressing your stress levels, addressing past experiences can improve your quality of life and sometimes even improve your lab results. So years back, the dialysis facilities where I was medical director had asked nephrologists a very simple question. Would you be surprised if your patient died within the next 6 months? And it's interesting that without looking at labs, without really diving into the specifics of the patient's medical conditions, nephrologists were pretty good at predicting. Why is that? They were probably looking at the patient's mood and assessing their mindset. And I'll tell you about 2 patients in my career. One patient I'll call JJ, I had met very early in my career. He was a patient in the dialysis unit where I was the medical director, not my patient. He was very angry, a lot of cursing, a lot of shouting. He refused blood pressure monitoring. He refused a lot of treatments expected to be put on, expected to be taken off whenever he wanted. And he was very verbally abusive to other patients around him as well. Now, as a medical director, I was not responsible for his medical care, but I was responsible for all of the patients within the clinic. And this caused a lot of disruptions to the clinic. It caused a lot of distress to the other patients who had to be treated fairly close to him. He ended up in the hospital because he wasn't getting enough dialysis and eventually died. When I think back to his case, I realize that he must have had some level of anxiety or depression or a combination of both. Very often, anxiety can manifest as anger, and that affected the health of him and those around him. So for this patient, I would have not been surprised if he had died within 6 months, and indeed he did. But I'll tell you about another patient. I'll call her Vivi. She was a working woman with chronic kidney disease, and she was nearing the time for dialysis. She started to have trouble concentrating at work and trouble sleeping. And this was very disruptive to her life because she really enjoyed working. It also added to the anxiety of her needing to start dialysis soon. Her sleeplessness, as it turned out, was related to restless leg syndrome. Restless leg syndrome is a condition where your legs jerk involuntarily. Of the many causes of restless leg syndrome, one of which is related to dopamine. Now, dopamine, you probably have heard of. It's one of those feel-good chemicals in our brain, and it affects memory as well. It's funny that it's a brain chemical because it's also produced in the kidneys. So we're just learning now through research about the kidney effects of dopamine, but we do know, though, in kidney disease that there are changes in the levels of dopamine, which can then affect our mood. We believe that this is one of the reasons why depression and anxiety and other mood disorders are so common in kidney diseases. Kidney diseases causes a loss of dopamine, which may be a cause of depression. Another factor is that as your kidneys lose the ability to filter out toxins or dialysis is inadequate, the toxin buildup also interferes with the dopamine system. Now, going back to my patients, you can imagine that JJ may have had abnormal dopamine levels from inadequate dialysis affecting his mood. So I just mentioned dopamine. However, there are other brain chemicals such as serotonin. Serotonin is a chemical that's related to happiness and calmness. Changes in serotonin can lead to also depressive symptoms, but also anxiety. So we're learning more and more about how the brain chemicals, such as serotonin and dopamine, are changing or change when you have kidney disease. And then on dialysis, depression has been shown to increase your risk of infections, hospitalizations, a lower quality of life, and death, of course. One thing that I want to stress is that people may not even realize they are depressed. It seems funny to say, but in a study of the people on dialysis, when they were asked if they were depressed, who said no, they found that 80% of them, even though they said no, tested positive on objective surveys such as the PHQ-9s. These are a list of questionnaires that ask for specific symptoms. So even though the patients said that they were not depressed, when you ask them specifically about symptoms, it seems as though they are. So remember, at the beginning, I said that I wanted you to remember 3 things. 1, if you are suffering from some depressive or anxiety symptoms or any kind of mental illness, you are not imagining it. Kidney disease and mental health are intricately linked. Again, don't let it become a vicious downward spiral. Recognize it. Pay attention to your mood. Pay attention to what you are feeling, how you are reacting to news. Second thing, important to remember, is that you are not alone. We heard from Madeline, we heard from Tifiro. There are many people with kidney disease, without kidney disease, even people who are taking care of you who might be struggling with mental health issues too. Peer mentors, professional help. There are resources that would be shared in this webinar. We know already from Madeline and from Tifiro and also from research studies that help works. This is the third important thing that I want you to remember. Help works, right? We heard from Madeline about cognitive behavioral therapy and counseling. We heard from Tifiro and Madeline about how important, how powerful exercise is in managing depression and anxiety. Reach out, access the resources from this webinar. This is why Kindness for Kidneys is such an important community. It's helping us understand that taking care of our minds is not extra, it's not selfish, it's part of taking care of our kidneys, it's part of taking care of our whole self. And we deserve that. You deserve that. We all do. Thank you.
Wow. Thank you so, so much, Dr. Wei. What a powerful, powerful um, information here, and just knowing that, like you said, we're not alone in this, that we, there is some science behind all of this. And so it's good to know that, because I know as kidney warriors, we sometimes feel that we're going crazy, that this is something that we're doing wrong, or that we're not navigating through the journey, no matter what that journey is, correctly. And so thank you so much, Dr. Wei. I truly appreciate what you shared here. Remember, please put your questions in the chat. We will have time for questions after our next presenter. And so we want to be able to answer your questions and allow you to get any resources that you need from the webinar. Our next presenter is Jeanne Johnson. Jeanne Johnson, I'm sorry, I'm still getting it right. Jeanne Johnson. And she's the owner and founder of Healing HMS, Hearts, Minds, and Souls, a faith-based, all-inclusive mental health private practice in Silver Spring, Maryland. A licensed clinical professional counselor and Maryland State Certified Clinical Supervisor, Jeanne specializes in trauma-informed care and provides compassionate therapeutic services to individuals of all ages, backgrounds, and life experiences. Jeanne is a proud New Orleans native and Hurricane Katrina survivor. And her personal journey through trauma inspired her calling to the mental health field. Her resilience and authenticity continue to shape her therapeutic approach and leadership philosophy. Additionally, Jeanne leads and trains the clinical team at Healing Hearts, Minds, and Soul while completing the final year of her doctorate in clinical psychology. Her doctoral work focuses on enhancing her clinical, supervisory, and leadership skills to expand the reach and impact of Healing HMS in the community. And so I welcome you, Jeanne. Thank you so much. I am going to continue to share the screen for you. And give me 1 second. I'm going to make sure I had you spotlighted, so I'm going to share. Okay.
Okay. Hello, everyone. So happy and privileged to be part of this, even in the midst of my studies. Just hearing everyone's stories and hearing Dr. Wei's connection. I'm just so happy to kind of hone in on the importance of mental health, especially as I'm fresh out of my 5-year doctorate program. This is some fresh information that I'm just so privileged and happy to kind of to take it home, because again, I know it was mentioned earlier, it's not discussed enough. And so I am here to talk to you guys about ways of reducing stress that is associated with this disease and any other stress that you might have in your life. I think this is helpful for all. So I'm glad that you all were able to be here. And we're going to go ahead and start with the next slide. So this is just a little agenda. First, I'm going to identify and help you guys understand the different types of stress. It was mentioned a couple of times before. I love that statistics where 80% of people don't even realize that they are depressed. And I don't think it's just regarding depression. Sometimes we can not realize we're under a lot of stress. And so I'm hoping that you guys will be educated on the various types of stress. Then we're going to get into the physiological impact of stress. And just how much it really impacts your immune system. We all have a circuit that is interconnected that was mentioned before. And again, just want to repeat that as well. And then I'm going to end on giving you guys some simple, easy techniques and things that you can use that will make it easy when you are in the midst of stress. And then I will end it with some tangible resources, ways that you can get support, ways that you can get connected to mental health services. So we'll go with the first slide with the types of stress. Now, these are a lot. But these are real, and a lot of us experience it without even knowing that we are under this. But the ones that I want to highlight the most, just for this particular webinar, first is acute stress, which is short-term stress that typically results from immediate stressors or challenging situations. So I know, again, I don't have kidney disease, but just hearing you all's experiences from the two stories earlier, going into the hospital, getting those results, those can produce some acute stress. So anytime you are experiencing a challenging situation, ruminating thoughts, you are under stress. That is acute stress. And then when you're under acute stress, the body's fight or flight response leads to temporary psychological changes that can result in your impacting your immune system. Then there's chronic stress. This simply occurs when that acute stress continues to persist over time. And prolonged exposure to chronic stress can lead to cumulative physiological and psychological effects, which again puts you at risk of health problems. So when you already have health problems, it just weakens your immune system even more with this chronic stress. Then there's episodic acute stress. This is just simply stress occurring when individuals experience frequent episodes of the acute stress. And that's when it can turn into that chronic stress. There's traumatic stress. Sometimes everybody's story is different. Maybe you had something traumatic happen and that's when you found out about your kidney disease. Maybe going in the hospital, it caused some level of trauma. So traumatic stress, this is just a result from exposure to traumatic events. Sometimes caregivers can be traumatized by what they saw or heard from what you experienced. Again, very real things. Then there's environmental stress. And this type of a stress arises from adverse or challenging conditions in your environment. Sometimes being in the hospital can be a very high stress environment. Somebody mentioned earlier today, just going into that dialysis center can be an environmental stressor for you. Again, you guys can experience various different forms of stress and not know it, which is why I thought it was so important to point these out. Now, the two that I am going to focus more on is the psychological stress, which is the stress that stems from your cognitive, which is your way of thinking, or emotional factors. Again, the emotional toll that is biological as well. As Dr. Wade was talking about the how your mood is impacted. That's what a stress can come from, based on perceived threats, worries, or just negative thoughts. And perceived threats is anything that you feel that could some way cause some form of harm to you. Getting those results, that's a perceived threat, because, oh my gosh, my life is about to change. Now, again, that stress is going up just based on those thoughts. Typical stressors can be manifested, such as anxiety, ruminating thoughts, perfectionism, depression. All of those things can come out as a result of the psychological stress. And then there's the physiological stress, which I think anybody who has any type of medical or chronic disease, you are under physiological stress, which refers to the body's response to internal or external stressors that disrupts your homeostasis. Examples include illnesses, injuries, sleep deprivation, or nutritional deficiencies, which activates your psychological stress pathways and compromises your health and well-being. So these are the various different types of stress that all of us are prone to. So we're going to go to the next slide, where we're going to talk about the impact of this type of stress on you psychologically. So the next slide kind of goes into the impacts of stress. When you're under that chronic and long-term stress, meaning that's you're continuing being exposed to these stressors, your body releases too many stress hormones that could result in impairing your body's anti-inflammatory response. And this could result in chronic infections, chronic autoimmune disorders, and even cancers in some cases. Additionally, I wanted to highlight some additional impact from this, which is it interferes with your white blood cell communications. And with the white blood cell communication, this coordinates the immune system response. So again, what do you think would happen when your immune system response is being impacted? Yes, it weakens your immune system. It also lowers the number of white blood cells, which are the infection fighting cells. And you specifically need that to help build your immune system. It decreases the body defense capabilities, which raises your risk for infections. It impacts brain wiring that oversees various immune functions. It decreases white blood cells. It reduces the quantity of antibodies in your system, as well as stress can stop or slow the movement of your immune system, which impacts its functioning on fighting pathogens to keep a healthy immune system. Again, I know a lot of this is probably repeated, but I'm a true believer that repetition is the mother of learning. And I think that hearing about the impact of stress, it truly does cause you to fight against your immune system when you need to be fighting with your immune system. And so we're going to go to the next slide so I can give you guys some techniques to help you to decrease the psychological stress, so you can help build a healthy immune system and help fight this disease, not just externally as well as internally. And so we're going to go to the next slide. So mindfulness. Let me explain something about mindfulness and why, in at least the psychology world, it is so helpful. Our minds, especially when it's anxious, and we already know how prone one can become to anxiety when undergoing kidney disease. What mindfulness does, our brains, when under anxiety, loves to time travel. You're either going into the past and thinking about all of those horrible experiences you've had, or you're going into the future. And most likely, if you're not being intentional with your thought, that future, you're thinking about the worst case scenario. And so again, all anxiety provoking, that's only going to increase your anxiety. And so what mindfulness is all about is just helping you stay in the present moment, to keep your brain from time traveling either to the past or to the future. And so I like to use a lot of metaphors. I love to give tangible things to help us remember exercises that we can use in our everyday walk. You can be sitting in the chair, and you could be sitting in the dialysis chair, you could be sitting in the waiting room, and just I have 4 little stones that I will sometimes give clients who really need some tangible things to remember. Because again, when your mind is anxious and you're overwhelmed, sometimes you need something to help ground you and remind you. And so these stones are simply reminders of techniques you can use when you are overwhelmed. So the first stone is a blue stone. It usually represents water. And since the human body contains about 50 to 60% of water, this is just a reminder to do a body check. Remember, when you're going and going and going, you're not recognizing what's going on. So that blue stone just reminds you to, hey, let me check my body for any tension or disturbances. How am I feeling? And if you're feeling tense, there's some practices you can use. So this particular stone, I like to remind people to do some muscle relaxation, which only includes you tensing up your body while taking a deep breath in, counting for 5 to 6 seconds, 5 to 10 seconds, and then you just release. That's sometimes stress balls help you. You clench it real tight for 5 to 10 seconds, and then you release. That's an easy, quick way to release the tension in your body. You tense it up, and then you let it flow. The red stone represents fire. And again, it's just a reminder to fire up your imagination. Take control of that time travel and think about something peaceful. Usually what I do with clients, sometimes I have them think about their safe place. This is a safe place where only you create the rules. Nothing negative can be in there, only positive. Sometimes I'll have them draw it out. And sometimes when I see that they're overwhelmed, okay, let's go to our safe place. Let's think about it. Let's bring ourselves right then and there. Again, a powerful tool to help you to control your thoughts. The clear stone represents air, and it's just a reminder to breathe. Breathing and anxiety can either increase your anxiety or decrease your anxiety. When we take in too much oxygen, that increases. And if you're breathing in too much, and that can also cause a panic attack. So anytime you're breathing, you have to make sure that you have more air coming out as slowly as possible than air coming in. And it really helps balance us. So there's a really cool technique that I like to use with my clients called the 4 square breathing. And it's just an easy way to achieve slower, deep breaths. And usually you breathe through your nose, as much air as possible, making sure it's coming from your diaphragm and not your chest. Then you pause for 4 seconds, and then you let it out very slowly, as if you're blowing a candle, but you're not blowing the candle out. You're just blowing very softly, letting all of that air out. If you do that 4 times, you'll start to feel the physiological differences. Sometimes people don't even realize that they are stressed until they do that 4 square breathing. And then the last technique that I love to use, which is one of my favorites, is the earth. It's a brown stone, and it's just a reminder to be grounded in the present moment, especially when you're feeling overwhelmed or anxious. And that brown stone just reminds you, you can use your 5 senses, and it's a technique you call the 5, 4, 3, 2, 1 method. You're simply looking for 5 things that you're going to identify with your eyes. Then you're going to listen. You're going to look for 4 things that you can touch. You're going to just touch 4 different things. Then you're going to listen for 3 different sounds. And then you're going to try to find 2 different things you can smell. And then my children clients really love this. One thing that they can taste. Usually I give them a piece of candy or some chips or a little drink, and just to be mindful of the taste. Doing that really helps ground you and helps you to be in the here and now. Again, these this stone grounding exercise, simple, easy ways that can really change the trajectory of where you are in that moment. So now we can go to the next slide. And this is just ways to connect with resources. A lot of times in my research, when researching why people don't use mental health treatment, a lot of times people just like, I don't even know where to go. And so I found that this was just really important. One, if you do have insurance, you could call your insurance, ask, hey, do I have mental health services that you guys will cover? And if so, can I get a list of referrals? And if I don't have mental health services that will cover, do you still have referrals? Because most likely insurance companies will have referrals. Psychologytoday.com, you can put that in your website. It's a website. It's almost like a directory. I'm dating myself, almost like the yellow pages of finding a psychologist or a therapist or a social worker. And it also has a filter where you can put in your insurance, you can put the type of therapist you want, you can put the location, you can put if you want online, if you want in person, you can put the specialties, and then they'll give you a whole list of therapists that meets that criteria. Also ask your primary care physician. I used to work in a hospital, and I was a crisis mental health clinician in the ER, and we always had referrals. And so ask your primary care physician. Call the ER. Hey, can I talk to your crisis? I need some referrals for mental health. They'll gladly give it to you, especially if it keeps you from coming in the ER. And they'll be glad to give you those resources. I would also encourage you to ask friends, coworkers, families. You'll be surprised how many of your friends, family, and coworkers are actually in therapy. Not a lot of people just openly tell people. Or have you ever been to therapy? And if so, can I get that person you went to? A lot of times clients come to my practice from word of mouth. And then you can reach out to this amazing practice I have in Silver Spring. We offer in-person as well as virtual sessions. I have a lot of good vetted clinicians who all have hearts for people. And we work with all types, all conditions, and we are here to support you all. One of the things about therapy, and what makes it so effective, it was once called, or it's still called, the talking cure. There's just something about talking through that just helps change something within you. I can't tell you how many times after I've had a distressed client talk to me, and by the time they let it all out, they're like, oh, I feel so much better. Again, lessening that stress and increasing your immune system. It's the best thing you can do. Now, if you need immediate services that does not require you to have insurance, you can text if you feel comfortable with text. There's a text hotline, 741-741. You can even ask them for resources. You can also call the Suicide or Crisis Lifeline. Simply 988. It is something new in Maryland that they just created. So you don't have to call 911. Call 988. And no, you do not have to be suicidal. If you're in crisis and you are just not sure what to do, they will be there to help you. And then for support groups, I did my own research, and in addition to Kindness for Kidneys, here are some additional supports. Some are virtual, some are local, but they seem to have a lot of support groups, not just for you, but also for your caregivers. So again, I'm hoping that these are some tangible resources that you all can use either for yourself or for your caregivers, because it's needed. And yes, that is all I have. And these are the next slide is just my references from some of the information that I shared. And it was a pleasure talking to you all about the mental health side of things. Thank you.
Thank you, Jeanne. That was powerful. And I really like the talking cure. I'm like, we may need to go back to that so that people understand that counseling is not this thing where you're coming to talk. And so I'm going to stop sharing, and we're going to all come on camera, our panelists, to answer any questions that you may have. And so feel free to put your questions in the Q&A. I did see a hand go up earlier, but I didn't see. Oh, okay, I do see. Great. I do see one was answered. Does anyone else, good to see you here, Glenda, as well. Does anyone else have any questions for our panel? This has been amazing. I can say that I'm walking away with even more resources and things that I can do as a transplant warrior to support my mental health journey as I walk this journey out. And I hope that you all also have gained a lot of feedback. I do see a question that's come in. Thank you all for sharing your knowledge. She was struck by your story, Madeline, an experience. It says, have you seen signs of hope? And then providers seem more aware of mental health and seem to ask more questions. Are kidney patients more likely to receive mental health services now? Do you have an idea of the percentage? So several questions in here that I think different people can answer. But we'll start with you, Madeline. You're going to mental health therapy and you're doing exercises and things like that. And so the question is, have you seen signs of hope?
It's one day at a time is what I have to say, is one day at a time, living with chronic kidney disease your entire life. Like, I didn't even know I had kidney disease until I actually went to an annual appointment at 15 to know that I was diagnosed with chronic kidney disease. But it's just been one day at a time. When you say, have I seen signs of hope? My signs of hope is community, is the people you surround yourself with, having really great doctors by your side. Many of them, it's just about having, bedside manners as well. Some of these doctors don't have that. And you're already going in there with anxiety, waiting for results and to talk to you. And, you don't know what those things are. But even with that is like, it's like you come in and you go. It's not, there's no bedside manners. So I can't say that for all doctors. I wish there were more doctors like Dr. Way. I mean, I think that's excellent. I cannot even kid you. My only doctor that's done that is my PCP. And I've spoken to my nephrologist, of course, and she says, she did say that is great, that I'm going to, I am in therapy and that will be helpful. But it's just one day at a time, because this is, a lifetime that I live with this disease and continue moving on and living on. But community is everything.
Tifiro, I think it would be great for you to answer that as well. You've seen a lot of different phases of your kidney journey, from dialysis to transplant and now dialysis again. So it would be good. What about you? Have you seen signs of hope?
I do see some signs of hope, and where I see them at is when you get a rapport with your client, especially when I'm working with them over and over and over. Like Jeanne said, she said, the repetition is the mother of all, intellect. And she's so right about that. And that's where coaching comes in, where you get a rapport with people and you're talking to them consistently, and you're telling them about the mental challenges and they're talking about their mental challenges, and you see glimpses of them getting better. And what I mean by that is when they start exercising, if I do a nutrition plan or exercise plan for them and they start getting stronger, they start getting, better sleep, their labs are looking a little bit better. And what you have to do, like she said, Madeline said, one day at a time is really important. And what I believe, and I tell my clients, is let's get 1% better each day. If we can get 1% better each day, and that's good. Okay, I walked a little bit longer. Hey, I ate a little bit better. My labs look a little bit better. And we have to reinforce these good things when we see them, and reinforce them and let them know that, hey, you're moving in the right direction. When you're moving in the right direction, that's always getting better. And you have to take them as small grains, but these small little things mount up to getting better and better and better. So that's where I do see people getting better.
Awesome. Awesome. Dr. Way, I see you may be typing. I'm not sure if you've, oh, yes. So,
Yes.
King. Okay, great. Great. And so, and I think it's echoed throughout all of the presentations here, especially yours, Dr. Way, and yours, Jeanne, and how professionals are coming together around this area of mental health. It's not just something that we've kind of put on the back burner, but we're seeing the importance in that connection between how I think and how my body responds, and that they go hand in hand. It's not I'll take care of this over here and this over here. It all works together, and we have to consistently do it. We can't you focus too much on one and not the other. It really has to go hand in hand there. And I see some other comments that are coming in, just saying thank you. Glad that this is helpful. Sherry Ruff and Jeanne had just a question about the references, and the slides will be sent out to all attendees. And so we will get that over to you. Any other questions? Any other questions? This has been so good. And I hope that this is a conversation that we will continue. It's not something that we just do once a year or what have you. I really hope that this is something we'll come back and constantly talk about. Any questions? Any other questions for our panelists? Or anything that anyone wants to share? Maybe something that's been helpful for you? Okay. Well, we will be sending a follow-up email out after our session to share the resources that were mentioned here. And also, if you have additional questions, I know for me, sometimes I leave a session and I'm like, oh man, I was supposed to ask that, but I forgot, or something comes up after the fact. And so I do want to take time right now to just say thank you to our panelists. This was absolutely amazing. They are amazing people, and just outside of this workshop and outside of this webinar. And so I'm just grateful that each one of you took some time out on a Sunday afternoon to come and share your journeys. I know, especially for Kidney Warriors, not always easy for us to come and share those vulnerable sides of ourselves. And so I just want to thank you for coming out, for sharing, just being vulnerable. I think it's very helpful when we're upfront and honest with people and are able to share our experiences. I thought I saw one more question come in, but I think you got it. Dr. Way, is that true? I don't see it anymore. Thank you so much, Glenda. Thank you. I truly appreciate your comments. And this will be available for viewing afterwards. And so you will get this is available on demand. And then if you're on our Kindness for Kidneys email list, you will get also the link to see this on YouTube afterwards. I do want to just leave you with our information. We hope that those of you that you're new to Kindness for Kidneys, that you aren't that this won't be the last time that you visit us. And so thank you for joining us. You can sign up for our website at kindnessforkidneys.org. And then we're available on all of these platforms here at Kindness for Kidneys. So if you just Google Kindness for Kidneys, or you go search in any of these platforms, you will find us. We meet on the second Sunday of each month for our support group. And so this is an extension of our support group this month, having this mental health webinar, but it does go hand in hand with our current holiday drive, where we're providing mental health care bags for local dialysis warriors in our community. And so wanted to provide this session. Some of you are probably on that are going to receive that bag as well. And we hope that this will continue to inspire you and encourage you. And so thank you again to our panelists. I'm so grateful for you. I'm so grateful for all that you're doing in the community. And I think this is what community looks like. All of us coming together, physicians, patients, kidney care coaches, just all of us coming together, clinicians, therapists, all of us coming together to work together to help each other. And so thank you all for coming. We're grateful for you, and we hope that this won't be the last time that we gather in community. Have a wonderful week.
And thank you, Sharon. And
Thank
congratulations on such a successful webinar. Woohoo!
Thank you
First
so
one.
much. Thank
First of
you.
many.
Yes, thank you.
Thank you. Yes, the first of
Great
many. And
information from
congratulations.
everybody. I loved everybody, what they spoke about. Everybody had great information, and I loved it.
Yes.
Yes,
Thank
I agree.
you.